Eclampsia, which is considered a complication of severe preeclampsia, is commonly defined as new onset of grand mal seizure activity and or unexplained coma during pregnancy or postpartum in a woman with signs or symptoms of preeclampsia. It typically occurs during or after the 20th week of gestation. Eclampsia is associated with approximately 13% of maternal deaths worldwide. An eclamptic seizure requires immediate, effective treatment. A bolus of 4 to 6 grams of magnesium sulfate is given intravenously in 100 milligrams IV fluid over 20 to 30 minutes, followed by 2 grams per hour IV infusion. Antihypertensive agents are used to keep the diastolic pressure between 90 and 100 milliliters of mercury, thus avoiding a potential reduction in uteroplacental blood flow or cerebral perfusion. A sedative, such as diazepam, is used only if the seizures are not controlled by magnesium sulfate. The lungs are auscultated for pulmonary edema, and Lasix is usually given. The woman is observed for circulatory and renal failure and signs of cerebral hemorrhage. The woman is assessed for signs of labor and is checked every 15 minutes for evidence of vaginal bleeding and abdominal rigidity, which might indicate abruptio placentae. While she is comatose, she is positioned on her side with the rails up. Because of the severity of her condition, she is often cared for in the ICU. Complications of eclampsia include permanent neurologic damage from recurrent seizures or intracranial bleeding, renal insufficiency, fetal changes such as intrauterine growth restriction, hepatic damage, hematologic compromise, increased risk of recurrent preeclampsia with subsequent pregnancy, or even maternal or fetal death.